Staff from every department at Hull and East Yorkshire NHS Trust are being moved to assist with frontline duties. Operation Wintergreen sees some surgery and outpatient clinics cancelled. This is so that the staff can meet the hospital's demands of emergency admissions over the past few weeks.
I mean, it's a kind of extension really of the national mandate, which has seen us cancel some patients over the last few weeks since the beginning of January in order to improve our capability to manage all of our all of our emergency work. I mean, we do provide very safe care in our hospital. I think what we are trying to do is to provide that in a much more timely manner than we have been in recent weeks. I think it's also worth to notice, or to note really, that like other hospitals, we have been under a significant amount of stress. It's not unique to Hull and East Riding. I think what we're trying to do this week is to ensure that we've got more senior decision makers on the front line. So we've got our key specialties such as cardiology, respiratory, acute surgery, trauma and orthopaedics, who will be reaching into our A&E department and kind of across our ground floor in order to give a more timely senior kind of decision. And I think by doing so, we do expect that we will potentially avoid admitting some people. And also at the back end of the hospital, what we are doing is to expand our kind of ward round capacity with our senior decision makers. We would normally have a consultant ward round on all of our kind of key specialty areas every day, and what we're now doing is to ensure that that happens twice a day, and actually that will allow us to, perhaps if someone has blood tests done in the morning, that the results of those are back in the afternoon, and then decisions can be made about progressing people's care. So I think it's a kind of twin approach really, all about kind of looking at, can we avoid people coming in by perhaps engaging other services to support them or getting them home? And then at the back end, actually trying to expedite people's journeys in terms of getting them out of the hospital. So it's doing both things. We've also got our acute medical specialties working until 10 o'clock in the evening within our ED. They would normally work in our assessment areas at that time anyway. So we're just expanding that a little bit. And I think that will definitely make things easier for the people that are on the ground, but also I think be a much better experience for patients, because they will see first time the right person that they need to see in order to expedite their care in a timely way.